Hello, we're answering questions on health and medical problems. I'm joined by Dr. Rosemary Leonard. Hello.
Hello.
Rosemary, I've got a question from a mum who took her young son to play football in the park, and after a little while she says he became short of breath and started wheezing. She wants to know, could he be asthmatic?
The answer is yes, he might be, but it might be he's just got a bit of a cold which has made him a bit wheezy. The other thing he could have is what we call exercise-induced asthma, which is when you run around, then your airways become narrowed. Really, the diagnosis for this depends on how he responds to a medication to widen his airways. And if he finds that he always gets a little bit wheezy and breathless when he does exercise, and then if you give him an inhaler which widens the airways and that relieves it, it does suggest that he's got asthma. Then what you need to do is see how much he's affected at other times when he's not exercising. If you've got a child who is just wheezing when they exercise, then it's all right to use an airway widening inhaler. But if he appears to be getting wheezy at other times, he may need a second inhaler which acts as a preventer, and that type of inhaler you use all the time, not just when he's doing exercise.
And that, of course, is more serious asthma.
Yes, it is more serious. Generally, asthma nowadays, you aim to use the reliever medications which widen the airways as little as possible. The only exception to that is exercise-induced asthma, where you just say, use it before you do your exercise.
So you'd have to watch your child and see if they have that symptom every time they run around?
Yes, I mean, the other thing to do is to watch out to see if he's coughing at night time, because a common thing with asthma is not wheezing at night time, but just a nighttime cough. So look out for other symptoms and go and discuss it either with the GP or with the practice nurse, because most practice nurses now are experts on asthma.
That's interesting, because we always think of going to the doctor first. Do you think we're not using the practice nurse as much as we should?
Yeah, nurses are very good with children and asthma, and they can give them lots of advice about using the inhalers properly and also measuring how badly their asthma is affecting them. They can actually teach them how to measure their airflow.
Oh, very good advice, as usual. Thank you, Rosemary. Well, if you have a similar problem, we hope we might have given you some help, but remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.